In this video, I am going to teach about OCD. It means obsessive compulsive disorder. The person may have signs and symptoms of washing hands again and again. So today I am going to explain the treatment for OCD patient. So these are the treatment modalities for OCD. Number 1 is psychotherapy, 2 pharmacological treatment, 3 ECT. ECT means electroconvulsive therapy. Fourth one is self-help and coping. And the last one is psychosurgery. So now we'll see one by one in detailed manner. So the first treatment is psychodynamic. So it is a form of depth psychology. This can be used for the patients who are psychologically oriented. It is useful in long term, short term, supportive, and crisis interventions. People feel and behave as they do for specific reasons. The therapy is based on psychoanalysis in which the patient is made conscious about their unconscious thought and motivations that grieving insights. So the next treatment is cognitive behavior therapy. It helps a patient to explore and understand alternatives way of thinking and challenging their beliefs through behavioral exercises. So it makes use of two evidence-based behavior techniques, cognitive therapy that looks at how we think and behavior therapy which looks at how this affect. So what we do in treatment, we consider other ways of thinking and how this would affect the way we behave. So it's based on the concept that your thought, feeling and actions are interconnected and that negative thoughts and feelings can trap you in a vicious cycle. So that's why you're doing that hand washing and again. So as an image perfectly illustrate the treatment. So the next slide is the next treatment of supportive therapy. It helps the patient to relieve emotional distress and symptoms without probing into past and changing the personality. It won't do anything in the past, only it will be deal with the present situations. So in this therapy, it have the technique of the ventilating the feeling, environmental modifications and re-education, reassurance, explanations and guidance along with the family members also. So we are involving the family members to treat the patients. So the next treatment is pharmacological treatment. Here we are having three category. One is benzodiazepines and another one is antidepressants and the third one is antipsychotics. So here under the benzodiazepines we are having the two drugs, alprazolam and the clonazepam, and antidepressants clomipramine, fluoxetine and fluoxamine. So under the antipsychotics, haloperidol, risperidone and olanzapine. So these are the drugs we will be prescribed to the patients based on their severity and their age and their symptoms. Okay, so next we'll move on to the next slide. It is a electroconvulsive therapy. So that electroconvulsive therapy is presence of severe depression with the OCD and ECD may be needed. Okay, so in ECT it is particularly indicated when there is a risk of suicide and or when there is a poor response to the other modes of treatment. For example, you given a drug pharmacological treatment and the other psychotherapy, behavior therapy, everything you given, but that is not given proper recovery from the signs and symptoms. So that time we can go for the ECT for the severity. This one we can't give it for the old age people. So the next one is self-help coping. So here self-help coping, we are changing their lifestyle. So we are keeping a healthy lifestyle and being aware of warning signs and what to do if they return can help in coping with the OCD. So unrelated disorders, also using basic relaxation, technique like meditation and yoga. This too is helping very much to recover the patients from the OCD. The meditation yoga is very very important to recovering the patients. So the next slide is psychosurgery. This is the last treatment also, and for the severe patients. So it is mostly no doctor will be go for the treatment unless until it is very serious they may go for this treatment. So here what they are doing in that surgery means it may involve the removal or disconnection of brain regions. Okay, that is the two regions responsible for this